Hi, welcome to another episode of Facebook Live with Veterinary Referral Center of Central Oregon. I'm Jen Bentley, one of the board certified dermatologists here at VRCCO, and I've got Dr. DeHoich joining us today. He's one of our 3 surgeons here at VRCCO. And we have a bit of a different topic to discuss. I don't think we've really done anything like this. So we are going to be talking about the nationwide veterinary crisis. And so you probably haven't actually have heard that there's a veterinary crisis, but that's what we're going to be discussing, why there's this crisis, how it's affected our practice, and things that we're doing to mitigate it. But basically, in general, the crisis has stemmed from, 1, a labor shortage, and also 2, an increased demand for healthcare for pets as well. And I actually didn't even realize there was this massive labor shortage for the veterinary profession. It wasn't until I randomly came across a Washington Post article that said the top industries hit by the labor shortage in America. And of course, the veterinary industry was one of those 7 industries that they had mentioned. So pretty serious to know. And that is what we're going to be discussing today. And please, if you have questions, we may or may not be able to answer those questions, but we'll do our best here. But I will get us started and asking Dr. DeHoich, what has caused this labor shortage in the veterinary industry, and how has it affected VRCCO, if it has, and what are some things that the hospital is doing to mitigate that?
Yeah, no, I mean, when you kind of mentioned I didn't know there was a labor shortage, I'm thinking in the back of my head, oh, I felt the labor shortage.
Yeah, it's always, yeah.
So I've been feeling it for quite a while, and I would say that, there's been a labor shortage well before COVID.
Right.
That goes without saying. It's always been tough to recruit talent, for sure. Everybody kind of has this assumption that because they had a dog or a cat, or they took care of pets, or they somehow, fostered somebody, that they have the medical knowledge to jump into the profession.
Yeah, what it takes. I own a dog. I can do
I own a
this.
dog.
Yeah.
I can jump into the profession. In reality, that does work in some circumstances. But if the kind of operation that we have, where we do specialty medicine and emergency medicine, we certainly either need people with that skill set coming in with formal training, or we need to figure out a way to train them up. And so that's one of the big things that we have trouble with, that we can't seem to get them fast enough. Bend is still a small town. It's growing at a hyper, super fast rate right now. And the people that are moving in aren't necessarily certified veterinary technicians or experienced veterinary assistants or doctors or veterinarians themselves. And so that's made it a real challenge to kind of keep up with the growth. And then on top of it all, turns out, when COVID first started, I remember we sat down and we made an emergency plan on what we were going to do when the caseload dropped.
Yes.
Because we figured, well, everyone's going to, just be at home, not work, probably not take their pets to the vet, and just isolate themselves. And the exact opposite happened. People were at home and they realized that their dog was limping or not feeling well.
Right.
Or they realized, you know what, I'm at home all the time. Like, I could use some company that won't give me COVID, So
now we're adopting our animals.
So there was, this adoption frenzy. And so this all these COVID babies, I guess,
A massive adoption frenzy too, and there's some statistics on that as well. But I even had problems adopting a cat. I went up to Portland to a shelter. There were literally 2 cats in the entire shelter. And so definitely there was a lack of cats and dogs in these places. And you really have to go through a very formal process at most of these adoption centers.
Yeah, you almost
put in your application.
I
know. Like, I'm a veterinarian trying to adopt a sick cat, and I actually didn't get the cat. There was somebody who put in their application first. So, yeah. And then going back to kind of, the difficulty finding these qualified candidates, is there just not enough schools producing people? Is that really what it stems from, or is it the nature of the work itself?
I think it's a great question. I think, to be honest with you, there are plenty of schools out there. I would say there's even now privatized schools that that are out there. I think part of it, I don't know the right answer to this, to be honest with you. You probably don't want to hear me, but I'll also say what I got to say anyways, right? So I would say that for veterinarians, there are plenty of schools, but not everybody that comes out of the veterinary school ends up working full time.
That's true.
And I think that's a big problem. And so you're training all these super, super bright people, and you're assuming that they're going to take full-time jobs, and then they don't.
Yeah.
And so that's really crippling the profession. So that, and also you have people that aren't going to certain areas where there's needs, whether it's geographical, whether it's a specific.
Right, they're going to the fun cities, Austin.
Right, exactly.
Yeah.
They're going to the cool places to live. And so that makes it kind of hard to say, well, let's bring, that here. And also, big cities, higher caseload, higher cost of living, higher pay, sounds good.
Yes.
Small town, less busy, not as many cases, sounds like a lower pay, and so it's kind of hard to recruit sometimes. There's basically a war going out there on who can get people, and people are throwing out bonuses left and right, just like we've seen in all industries.
Yeah.
In all industries.
And then what would you say in terms of, here at VRCCO? I mean, you already alluded it's been hard to find talent, but it seems like we've actually been hiring through this time, whereas many hospitals have actually been decreasing their number of employees, which is great. But anything else that, in terms of what we're doing here, like how effective do you think we've been by kind of this scenario?
No, I guess, was there a question real quick? Yes.
There was a conversation starter, so you can jump into it now or you can answer this one.
Here, I can answer this question. So I would say that it's been really hard to keep up. So we had, I guess, when COVID started, I think we had half the staff that we have now.
Sounds about right.
And so we were kind of growing anyways, because we're a startup. We're not an old hospital that's been established for a long time, and so we were kind of on the expansion phase anyways. But all of a sudden we hit like this hyper growth phase, I think. And to me, that's very dangerous because the reason we started this is we want our employees to be happy. We want our our vision here is if our employees are happy, the pets are happy, right? If the pets are happy, the clients are happy. And so then everyone's happy, and that's the journey. How can we figure out a way to go beyond expectations for our employees, for our pets, for our owners, and do that on a consistent basis? And so when we are understaffed, then we have our high performers, which is pretty much all of our staff, because in order to work here, I think you have to be a high performer. Otherwise, you sort of get flushed out. It's just the nature of the beast. We need really, really good, dedicated people. And so if you get flushed out, then that makes it harder to hire too. And so I guess it's been really hard for us. Bottom line, it's been super hard. I think we've been one of the fortunate hospitals that's been able to grow through this. Because what's happened in many big cities, these hospitals have imploded and the entire staff just decides to quit because they are just too busy, underappreciated, overworked, can't find help, and it sort of reaches a breaking point. And that's my fear, that it can happen to us. There's no reason it won't happen to us. And so we've been really fortunate that we've been able to grow through this crisis and sort of disaster averted so far. But man, what keeps me up at night is knowing everybody's working their butts off and knowing that we're still a little bit understaffed and we're working our butts off because we don't cut corners. We do not want to cut corners.
Right.
That's important for our patients and then the staff we have, you don't have to tell them. They won't cut corners. It's hard to get them to go home.
They're pretty amazing.
We're so lucky, and it just inspires me to work harder, right? And so I think we're pretty lucky from that standpoint.
We absolutely are. I think to go off on that, there's a lot of, you guys may not know, but in a lot of these bigger cities, we're already seeing the effects of this labor crisis. So we're already seeing major hospitals, these are big corporations. They're actually, most of them are owned by Mars. If you didn't know that, it's the candy company Mars. But we're already seeing them basically limiting ER times, even actually disintegrating their ER departments and having only specialty and diverting patients as well. And we've even seen patients being diverted from Portland down to us because they have 12-hour wait times up there and it's faster to drive to Bend to get into us. So, and that of course creates the snowball effect too. As hospitals are cutting their hours, the hospitals that are remaining are taking up that load. Now it's more patients on our already staff that's kind of at that level too. But I think now's a good time to take that question.
Yeah, Susan Richmond put a couple of comments in here that you guys might weigh in on. She mentioned that getting Fanny to be seen was a nightmare. I'm not sure what she's talking about, but then she said, I've learned how to give my dog SubQ fluids and injections. Are you guys hearing of that from other people, and what do you think about that?
Yeah, that's not anything new, the SubQ fluids and injections. That's something that patients with chronic kidney disease, it's something that's commonly done, that people will get trained up on and do as long as they're comfortable, and it takes the right patient, right? If the patient has a bad temperament, that's something where you don't want the owner to get bit and whatnot. But if it's a really nice patient, you can get away with that, especially if it's something that has to happen on a every other day, weekly basis in order to get them to do their regular thing. But yeah, I agree. It is a nightmare. One of the things that we are working on, which is still a ways away, is figuring out a way to, and we're talking to a technology company on this that we already work with, is trying to be more transparent about wait times. So that if there is a 2-hour wait, you can see that and say, well, I guess I should probably make an appointment with my vet instead of try to go to the ER vet where I don't know what the wait time is going to be. And it turns out my dog is just itchy and I can probably just schedule an appointment, and my dog is truly not an emergency, but it was just going to be convenient to try to get in, now because it's itching and I can't sleep and it's annoying or something. And so I think that kind of leads to doing your best to kind of have that relationship with your veterinarian is ideal, so that they can, you guys can go to your regular visits and have that planned out, so that we can catch problems before they become problems, so that you don't end up in the ER for something small that you get really frustrated because there's this bottleneck and you've been. The worst thing, and I totally get it. Like, I would be super frustrated if I was on the other side and I came in and I've been there for 30 minutes and I see somebody else walk through the door and their dog gets seen before my dog. Like, I'm immediately going to be totally upset. And what people don't understand is that there's a triage to this. That dog got seen before, not because we like them more, but their condition is just more serious. And so then that person who's waiting is unfortunately getting bumped. And it can happen over and over and over depending on, the resources that we have in the hospital. And so, as our resources are tapped out, people are going to be affected. And the one thing I can say is, please be patient. We do this out of, there could be other better jobs that pay better than this that I could be doing, So when you guys are mean to us, like, it's not going to speed up the care of your pet. And all it's going to do is going to really upset our staff, and we need them. We can't do this without them. It's one thing for, it's one thing for us to work hard, but it's another thing for us to, trying to go above and beyond, and you guys don't see it from our end. But we get tired also. We're human also, and the most we can say is please be very, very patient with us. Please be understanding. And when I say us, I mean the entire profession.
Yeah, the entire profession.
I'm not talking about our hospital. I'm
Yeah.
talking about our entire profession. Just be patient with us. Be understanding. Know that we went into this because we love animals just as much as you guys do, and our goal is to take care of your pet. But it's going to take us a little bit longer right now because we don't have all the help we can get, and we're trying. Believe us, and I know you guys are seeing it too with all the restaurants and pretty much everywhere. Except that we've been dealing with this for a year now, and only everybody else is seeing it recently, actually longer than a year.
And I think that's true. It's nationwide, so this is all the veterinarians and staff they're working overtime every single day trying to keep up with things. And it's to just have a little bit of patience with your veterinarian can go a really long ways during this time. Do you think when is this going to end? When are things going to get better? Can you have the crystal ball for us?
Oh gosh. Hopefully soon. But I don't know. I don't know. It's one of those things where it's super awesome to be able to help that many patients. Like this is, like I'm on a high all the time, right? It's super fun when I'm doing surgery. All the surgeries, I love it. I don't want to stop. Where it gets bad is when I have to write the surgery report and do the paperwork. That's when I start getting. That's the drag, right? But I don't know when this is going to kind of slow up for us. I honestly don't think it will. I think hopefully the solution is going to be to hopefully attract people into the profession. On our end, we've implemented numerous training programs where we are training up our current staff. We have an anesthesia assistant position that we've created, and we're currently holding class for that, which our employees are, as usual, going above and beyond and coming in on their time off to be lectured on anesthesia and sedation so that they can learn how to more appropriately take care of our patients so that they can start stepping up more so that we can continue to handle that volume that we're getting without cutting corners, without compromising patient care. And so I think that's what I think hospitals are going to have to do more and more of is essentially train up people and unfortunately not have that luxury of waiting for trained people coming to them. I really hope trained people come to us, but it's not happening fast enough. So we're implementing our own training programs, and maybe that's going to help, balance things out, and maybe in 6 months or so things will be a little bit calmer for us.
And we also have some pretty exciting things on the way.
Yeah, we do. We're in the process of trying to expand. So we will be having about, if everything works out and banks are nice to us, we'll be having about a 26,000 square foot facility here in town to provide better care for everybody and essentially be able to manage the space needs that we have because the space is getting really tight, and we want to make sure it stays nice for the patients and for our staff. And our clients, our clients are kind of packed in sardines sometimes.
But they get beer, so.
Yeah, but there is always beer on tap for the most part, yes. Yeah.
All right, well, thank you so much for joining us on this discussion. I know it's not an easy one to talk about, and I don't think many practices, managers really want to talk about this subject and get it out there. So thank you very much. If you guys have questions, concerns, or comments or anything, please don't hesitate to post them to Facebook. We'll be happy to answer those questions or comment on your comments. And then I think that's about it. Thank you for joining us.